right, great. All right, well, we will go ahead and get started. Thanks for joining us. I am Emily Walsh. I am the new benefits specialist for home mods. I also do vehicle mods and respite, as well as overcost containment. So if you have any of those questions, those get sent to me. There are a lot of people on the call, so please make sure to mute yourself. And if you have a question, feel free to take yourself off mute or put it in the chat. And I'll let everyone else introduce themselves on the team.
Good morning, everyone. My name is Lydia Beals, and I'm a case manager generalist for HCBS. I work in the case management unit, and I assist with home modifications for helping with the case management process and also helping with rights modification understanding. I'll go ahead and let Ken introduce himself.
There we go. Hello, everybody. I'm Ken Nyder with the Division of Housing and Home Modification team, and I look forward to the presentation here today. Thank you.
Hi, good morning, everyone. I'm Naomi Hubert, and I am with the Home Modification team as well here at Division of Housing. So I think those are all the introductions we have. Is that correct? Okay. Yep. So I'll go ahead. I'm sorry.
Nope, yep, you're good.
I will go ahead and get started then. We have quite a bit of information to go over. So HCBS and DOH. So HCBS is Healthcare Policy Financing and Financing, which is the state Medicaid office, as you already know probably. And then DOH is Division of Housing, which is within the Department of Local Affairs. These two agencies, we have an interagency agreement that we developed back in 2015. For the Division of Housing to assist HCBS with the home modification benefit. But we do have specific roles. Healthcare policy and financing, that's where all the rules and policies are. It's still Medicaid, so we still have to comply with Medicaid rules, policies, and procedures. HCBS has hired a third-party agent to do all of their billing. So whenever there are payment adjustments or billing issues, the provider would have to contact that third-party agent. Unfortunately, we here at DOH are very limited as to what we can do when it comes to billing issues. The oversight of case management agencies is with HCBS. Also, the oversight and consultation of all the appeals. So if someone's home modification is denied or any Medicaid service is denied, those appeals are handled through HCBS. We at DOH do not oversee the appeals for home modification denials. HCBS also oversees the provider enrollment and termination. So if there is a home mod provider or home mod contractor who, let's say, is not doing a good job or, you know, is just not good, we here at DOH, we cannot fire that contractor. Case management agencies, you also cannot fire, you know, quote unquote, fire that contractor. Only HCBS can remove someone from the status of being an enrolled provider. And that is done through their program integrity process. They look at, you know, all the providers to see if they need to be terminated or not. And as Emily mentioned earlier, HCBS reviews vehicle modifications, requests for vehicle modifications, and they also review the request for AT. We at DOH, we only review home modification requests. We administer the home mod program, the day-to-day aspects of that program, and we just ensure that all parties are in compliance with those rules and those regulations. So what is a home modification? So this is taken directly out of the rule. And as you can see, the previously or formerly known waiver as, you know, SCI for spinal cord injury is now CIH. So you still might see us refer to it as SCI until we get used to the CIH, or until that's, you know, changed everywhere. But these waivers are what we call the adult waivers: EBD, CHI, which was formerly the spinal cord injury, BI for brain injury, and CMHS. Those are the waivers under this home mod benefit. And again, it is to, these are home modifications that are done to the person's primary residence. So we cannot modify, the son-in-law's home, the daughter's house. We can't modify their cabin in the mountain. It is their primary residence. It's necessary to ensure their health and safety. And if you look at the slide, you'll see that the "and" is bolded and red. So these are the criteria that have to be met. These are not "or" statements. So it is kind of can be a high bar to meet. So it has to be done for their health and safety and allow them to function with greater independence in their home. And it has to be directly related to that person's disability or condition or illness. And it has to be necessary to prevent institutionalization or to support them to stay in the community. Okay. And how much funding is available for this home mod benefit? So there is a $14,000 lifetime cap per client. So once they use the 14, they're done. Rule does allow for us to go over the cap. And we will later in the presentation, we will talk about the Arpa funding, which is the American Rescue Plan Act funding, but we'll discuss that later in the presentation. But the benefit itself only has a $14,000 lifetime benefit. To go over that cap, again, they have to meet additional criteria. One being they have to meet that immediate risk of being sent to a nursing home. So if they've been living in their inaccessible bathroom or using it for the last 3 years, then there really isn't an immediate risk because they're still at home. Immediate risk would be like they're in the process of being sent to that nursing home because they need this modification that badly. Or their needs have changed since the last time they had a home mod. So if they previously had a home modification 2 years ago for a walk-in shower because they were able to lift their feet, they were ambulatory, but since then their condition has deteriorated to the point that they have to use a wheelchair all the time. Well, now they need a roll-in shower, so we would be able to consider going over the cap for that, for reasons such as their condition changing. What settings are the home modifications eligible for? So rental property, yes, we can address rental property. We do really want to look at less, I guess, permanent installations in a rental property because once they use their 14,000, they've used it. So if they've used it all in one rental property and then they move to another rental property or someplace else a year later, they're not going to have any home modifications to address that new residence. Yes, they can go over the cap, but again, that's additional criteria. And then yes, they can use ARPA funding, but that money is not forever. It will go away. So we do want to look at ways that we can do things not so permanent within a rental property, but rental properties are eligible. Congregate housing is not at all a benefit. Subsidized housing. So if your client lives in an apartment, typically it's going to be an apartment type community, and they tell you that they live in HUD housing or the landlord is the housing authority for that local jurisdiction, or they're getting some type of rental assistance or something like that comes up in the conversations, please let us know, because these property owners that own federally subsidized housing, they are required by federal rule to not only allow the modification, but they have to pay for it. So we cannot use home mod funds for properties that are federally funded. If you're not sure if your client lives in federally subsidized housing, you can shoot us the email with their address and we can look it up and we can confirm whether or not that is someone that we wouldn't be able to assist with Medicaid funds. And the Division of Housing, just kind of FYI, we are not an enforcement agency when it comes to fair housing or federally subsidized properties. If that property owner or that landlord is refusing to do the modification or they're pushing back on it, unfortunately, we at DOH, we can't force them to do it. We're not an enforcement agency. We can refer the client to the local fair housing office that can assist them with that. We can provide education and information, but we're not able to enforce those federal mandates. Okay. So what can case management approve? So you are able to approve home modifications that are 2499 or less. You can approve the installation of DME, but you cannot approve the purchase of DME. There's DME is a separate benefit and state plan that the client would need to go through to purchase the DME, and then home mod funds can pay to have it installed. Then repairs to a existing home modification or service calls. We do continue to get a lot of questions about this. So if someone had a ramp constructed 5 years ago, 3 years ago, it doesn't matter who built it or who paid for it. If it's falling apart today, Medicaid funds can be used to repair it. If someone had a stair lift installed 3 years ago, 2 years ago, 5 years ago, 10 years ago, again, it doesn't matter who paid for that stair lift or that VPL or the incline, whatever it is, and it needs to be repaired. Yes, a service call is needed in order for the contractor to be able to determine what has to get repaired in order to prepare a bid. So yes, service calls are covered, and you can approve a service call for those repairs. Repairs to a bad home mod, no. And what we mean by a bad home mod is if an enrolled provider, whether it's well, CCBs can be an enrolled provider, but not a SEP. This is SEP training, sorry. I got myself confused. This is a SEP training. So the enrolled provider, let's say they build a ramp 2 months ago and it's already fallen apart because it wasn't constructed correctly. That is not a repair that you can correct or that you can approve. That contractor has a 1-year warranty on all of their work, and they need to go back out there and they need to correct their own work. In these situations, you need to let us know, so because that's going to probably or will require an inspection to determine like what happened to this ramp or whatever it is that it now needs to be, corrected 2 months later, and to ensure that that contractor is going to take care of those issues. So all modifications are covered by a 1-year warranty. All of the home mod providers have to provide a 1-year warranty. So that's why we ask that if something needs to be repaired in that first year, that you not approve it automatically, because it could be a warranty issue, and we need to confirm that. Was there a question?
There is. Rita Nolan asks, if repairs are needed but all of the home mod funds have been used, can repair services be paid?
So again, probably the only resource they would have at that point would be the Arpa funding. And again, we'll get into the Arpa funding later in the presentation. So I might putting off your question, but we will get to that. If they don't have any funding at all, I don't know that we'd be able to, because again, they could request to go over the cap, but they would have to meet that additional criteria. And for a repair, I don't know that would be that you could do that. So unfortunately, they wouldn't have any other funding available unless they've got funding locally or some other agency could provide assistance. But we'll address that as well with the Arpa funding later in the presentation.
Thanks, Naomi.
General home repairs. Was there another question? I'm sorry.
No, you're good.
General home repairs are not a home mod. So somebody calls you and says, hey, my dishwasher broke, my air conditioner broke, it's 110 degrees outside, I need it fixed. Something like that. That's not a home mod. And those are not things that we can get repaired. And then again, home modifications that for someone that lives in federally subsidized housing. It doesn't matter the amount, even though it's 2499 or less, you still cannot approve home mods for someone living in federally subsidized housing. And again, if you're not sure if they are, you can always send us the address and we can do that research for you. Okay. So what do case managers need to remember? So OTP evaluations are not required for home mods that are 2499 or less, but we do recommend that you get one. The OTPT may find other areas of the home that maybe the client isn't really aware of, that they're, because a lot of times what happens with people that have disabilities is that they adapt to their environment. So they may not realize that, hey, there's an easier way to get in and out of this bathtub. You know, if I had grab bars, but that may not be something that they think about. And the OTPT could recognize that and go ahead and get that evaluation done. So it's not required, but they're highly recommended. They still have to comply with the home modification rules. Just because it's less than that, or 2499 or less, it doesn't mean that you can just automatically approve it. It still has to comply with the rules and regulations of a home modification. Please verify that they have enough funding. If you're not sure, or if you're not sure where to look that information up, you can always ask us as well, and we can do some research to determine, you know, what funding does remain in that person's benefit. And then again, we'll talk about how case managers can use the ARPA funding. The home mods are cumulative, so during a person's certification period. So if their certification period is January 1st of 2022 through December 31st of 2022, they get a home mod done in January for $1,000. You're able to approve it if it meets all the criteria. But then they come back later in July and they want a $2,000 home mod, and you're thinking, well, it's $2,000. It's less than that threshold. It complies. It's a home mod. I can approve it. You would not be able to, because the 1,000 and the 2,000 are now 3,000, and that is over that threshold within that person's cert period. So please keep that in mind. And it also does come out of their lifetime benefit as well. There's not like a separate pot of money for home mods that are less than that threshold. And then any changes to the member's eligibility, please let the contractor know. We've had situations where a client either passed away or went to a nursing home and was no longer eligible for home mod benefit. The provider wasn't made aware of this. The provider went ahead and did the home modification, and now they can't get paid because there is no eligible client. So please be sure and let us know, let the contractor know when someone's status changes. And you're encouraged to use the modification checklist tool. This will help you provide the home modification packet that we need. And Ken, in the presentation later, will go over in detail all the documents that are needed in that packet for us to do a review. Incomplete packets are a reason why home mods are held up, because we have to go back and get that information. So there's the link there for that toolkit checklist. So please refer to, again, it's not required. It's just a tool to help you provide the information that we need. Okay. So what is the process for a home mod that is under the $2,500 threshold? So there needs to be a need for that modification. So be sure that when your client calls you and they're asking for a home mod, that it really is a home mod and not a general home repair or something cosmetic or AT or vehicle. It is a home mod, and that it meets the criteria for a home modification. If it looks like the amount is going to be more or less than $2,500, and there's two different ways that you can go. If it looks like it's going to be more, they're calling, they're saying, hey, I need a roll-in shower. That's going to be more than $2,500. So if it is, then you need to send that packet to DOH and go through the whole process to get that home modification approved. If it's less than that threshold, they need a couple of grab bars, maybe a threshold ramp at the front door, a toilet, something like that, then you can go ahead and proceed with that. Again, you don't have to get the evaluation, but it is highly recommended that you do. You also need to follow your own agency's process and procedures for getting bids and soliciting bids, because we don't review those amounts of home mods. Then you would follow whatever processes that you have. Please keep in mind that you still do need to consider the most cost-effective way to meet that person's need. And then you add the home modification to the PAR in 2 units. Home modifications are paid out in 2 units, not that per dollar unit Like if the home mod is $1,000, you don't put in 1,000 units. You would put in 1 unit of 5 and another unit of 5. They start the project, they complete it, and hopefully everybody's happy. So, oh, look, it's time for a quiz. All right. So, and then just type your answer in the chat box. So case managers can approve anything as long as it is $24.99 or less. Is that true or false? It looks like everybody is putting in the correct answer. So it is false. Yes. Thank you. So regardless of the amount, if it's $1, if it's $10 or $100, it still has to comply with the rules and regulations of being a home modification. All right. So next question is OTPT evaluations for home mods that are $24.99 are not required. Is that true or false? Evaluations are not required for that amount. Awesome. I like those responses. True, but recommended. Awesome. Yes. Highly recommended. Again, not required, but we do, especially if in your area, it's hard to get an OTPT to go do an evaluation and you got a hold of one, you might as well have them go ahead and get it done. Okay. So what about home mod requests that are over that threshold? Now, these are the ones that you send to us for review. So the process is pretty similar. There needs to be a need again, identify that there is a need for a home modification. It's at that time in the process that we do ask that the statement of understanding be signed. We started doing this probably maybe 2 years ago now, I guess it's been. And this is a 2-page document that we want them to sign. It just kind of goes over what their responsibilities are as a participant of this program, what the contractor's responsibilities are as they work together. We were getting a lot of complaints and problems coming up after the fact because clients and case managers were changing the approved scope of work. And so this is definitely in this statement of understanding that they both understand that these changes cannot be made without approval. It talks about scheduling. It talks about the contractor's insurance, their warranties, things like that. So we do ask that they get this signed at the first step in the process. The OTPT evaluation is then scheduled with that member. It's completed. They send the OTPT or approved professional, send the evaluation to HCBS. I'm sorry, they send it out to contractors to get a bid. And then based on what's being recommended, it's at this point, Sue, that we ask case managers to look at it to see if a rights modification is going to be needed. And Lydia will discuss that a little more in this presentation. The evaluation and bid requests are sent to the contractors. They cannot do a bid without that OTPT evaluation. You can send evaluations to us before you get bids. If you're not sure of what the OTs recommend or the professional person is recommending, if it really is a home modification, maybe it's something unusual, something you haven't seen before. You can send it to us prior to getting bids. You don't have to, but that is an option so that we can take a look at it before you go through the whole processes of getting bids. Once the contractors have done their bids, they send them back to you. Members can need to review those bids, that they can choose which contractor they want to use. And just because they're choosing a contractor doesn't mean that everything on their bid is going to automatically be approved. We still have to review those bids for approval. It's also at this time that if you see that their preferred contractor's bid is over the amount that's allowed over the 14, then you can also consider submitting that over the cap request. And again, we will go over using ARPA funding later in the presentation. You send that completed packet to DOH for approval. we look at it, approve it, deny it, ask more questions, whatever is needed. Once it is approved, everyone is notified of those approvals. The contractor starts the work, they finish the work, and everybody's happy again. We can do inspections. If the client requests an inspection, we can go do an inspection. Currently, they're done on a random type system, but you can always, well, anybody really, HCBS, CMS, DOH, the client can request an inspection at any time. Okay. So home mod evaluations. All right. So these do need to be completed by the OTPT or an approved qualified individual. If you can't find an OTPT in your area, it's just taking way too long, or it's just having a hard time doing so, we can, you can let us know and we can send you information on the local RAE. And I forgot what that stands for, regional something.
Accountability, accountable entity.
Thank you. That can help you locate those OTPTs. And again, or an approved qualified individual. So if there's someone else that's a professional, that knows the client, that knows what their needs are, that's aware of their disability, and you feel is qualified to do an evaluation, you can let us know who that professional is, and HCBS and or DOH can provide the approval to have that person do that evaluation. But we do ask that you work with the RAEs first to get that OTPT person out there. They have to be completed on the Health First Colorado Home Modification Evaluation Form. It's a long title. There is a new updated one. I don't know if it's ready to be added to the website just yet. But whenever it is, we'll let everybody know, and we would ask that the OTPT start using that new form. I am working on getting a training for OTPTs probably in August. So we will be addressing that with OTPTs as well. The recommendations have to be based on that person's disability and their need, not because they want it, not because the caregiver wants it, or it'll be easier for the caregiver to do their job if they had this modification. It is not for caregiver convenience, and we absolutely do not want the contractor's opinion when it comes to an accessibility type recommendation. That's not their role. The OTPT, that's their responsibility. They're the professional. They need to be making those recommendations. The evaluations need to be completed in the home. I believe HCBS is still allowing for virtual evaluations because we're still having to deal with COVID restrictions and precautions. But it's still better if they're able to get that evaluation done in the home. Okay. And again, you can send us the evaluations prior to getting bids. If you're not sure about, what's being recommended, if it really is going to be, if it really is an eligible home modification. Okay, are there any questions?
Oh, I was just adding some information in the chat about how folks can determine who their RAE is and the email used to contact them if they're having problems finding a PT or an OT.
Awesome, thank you, Lydia. Mm-hmm. So home mod provider.
Hand raised, sorry.
Yes.
Tina, you can go ahead and come off mute.
Awesome. So my name's Tina. I work with RAE 4, Health Colorado. With the OTPTs, I know that they have to be credentialed with Medicaid in order to do the home modifications. So if we have in a rural county, if we have a certified nurse who is attached with both the RAE and the SEP doing the services for the member, and they are credentialed with Medicaid, are they able to do that home modification survey for members?
That would be a decision that we would have to make here at DOH and HCBS if we feel that individual is qualified to do the evaluation. As far as their relationship with Medicaid, they would have to be able to bill for that evaluation, which is between them and Medicaid. We don't deal with that billing. But as far as we're concerned, we would just look at that individual to see if professionally we feel that they could do that evaluation or not.
And just a follow-up question. When you say bill for services, since this is through fee-for-service, is that with that vendor that you had referenced at the beginning of your presentation? With the vendor that the state uses for the billing?
No. So in order for someone to bill Medicaid, they have to be an enrolled Medicaid provider. So they have to contact HCBS and complete their application to become a Medicaid provider.
Perfect. And if an individual is interested in doing the home modifications, can they just credential to do home modifications without having a credential to see a lieu of services? Does that make sense?
Well, there isn't any credentialing done. They just have to be an enrolled provider to provide
Perfect.
whatever service they want to provide. Yes.
Okay. Thank you.
Well, and just to clarify, Tina, the home modification evaluation is billed through their state plan benefits. So it's an OT or a PT evaluation that is paid for through state plan. So it gets a little bit more complex because it's a different kind of provider than, say, your HCBS waiver service providers who you are typically using. So if you have more detailed questions, you're welcome to email Emily and I kind of your scenario, and then we can figure out how to help you guys if you're looking to get that nurse approved.
Perfect. Thank you. Yeah, I think we've harassed Naomi quite a bit this past couple of months. So thank you for that support.
Thanks,
Sure.
Lydia. Thank you. So home modification providers. So you are responsible, agencies, your SEPs are responsible for maintaining your own list of providers that are enrolled. We don't keep a list here at DOH simply because we don't want to look like we're steering a SEP to use any particular contractors. We can get in trouble for that, actually. So you are responsible for keeping your own list of providers. There is a list on or a way to find out who an enrolled provider is on the HCBS website. I don't think it's up to date. I know it's not up to date, but you can still access it on the Find a Doctor page on the HCBS website, and you just put in what you're looking for, and you can search for anyone that's a that's a Medicaid provider, actually, but you can look for specifically home modification providers. Please notify us though if you are having a hard time finding a provider in your area. Again, maybe, I don't know if Rays are able to help with that situation or not, but we'll do what we can to help you find providers. We are always looking for new contractors. So if in your community you know of contractors, or maybe they ask you, hey, I've heard about this Medicaid program, I want to be involved, send their information on to us. We'd be more than happy to provide them with the provider enrollment information and hopefully get them enrolled as well. Okay. Lydia.
So I want to talk to you guys a little bit about rates modifications and informed consents related to home mods. Documentation of a rates modification is required for any home mod that restricts a member's rights. This is applicable to all members participating in the HCBS waiver programs and electing the home mod benefit. We have 2 operational memos out there that go into detail about the rights modification process and also give you the informed consent template. So please refer to those if you have questions about the rights modification process. The informed consent must be signed annually by the member or the guardian for an informed consent. And then we have some regulatory citings here for you for the final settings rule that specifically speak to rights modifications. Then we also wanted to talk to you a little bit about when documentation is required for these rights mods. So we have a couple examples for you here where we would want to see an informed consent. If we had to add sensors to notify a caregiver of a member approaching an egress, that would require a rights modification. Or if you wanted to add locks to a refrigerator or cabinets in the home to prevent excessive eating, that would also require a rights modification. This is not a comprehensive list of home mods that constitute a rights modification need. Please go see our rights modification FAQ and trainings if you have additional questions about these issues. You can also always reach out to me. I am the person who will be reviewing the informed consents that are submitted with these projects. So if you have questions about what needs to go on the form or what would be considered a rights mod, you're welcome to reach out to me as well. Does anyone have any questions before we move on? All right, it's back to you, Naomi.
Okay, so the bidding process. So you have to contact at least 2 home mod providers for a bid. You have to contact them. Okay, you don't have to get 2 bids, and that's still continues to be confusion in that. We get home mod packets where, you know, the first bid was received 6 months ago and they finally got a second bid, so you don't have to do that. They have I think that's the next. I think I'm jumping ahead, so let me just talk about the provider bid form. So we do have a new provider bid form. The enrolled providers have all been provided with this new bid form, so they should start they need to start using this new bid form. I believe it's also on the HCBS website as well. So contractors have 30 days to submit their bids. You've contacted at least 2 providers. If after 30 days you get 1 bid back, you can move forward with that 1 bid as long as the client is happy with that 1 contractor. If they don't like that contractor and they want to keep trying for more bids, then you can try as long as you want. But if you got that 1 bid back in 30 days, client's happy with it, send it in. You don't have to get any more bids. You just have to contact at least 2 home mod providers. They do have to follow those recommendations. So again, if you have an OTPT recommendation that you're not quite sure it's going to be a home mod, you can send that to us first before getting bids. But they do need to comply with what the OTPT is recommending. Contractors do not make accessibility recommendations. That's not their role. They can and should be addressing code items, whether or not something needs a permit, whether the recommendation that the OTPT is making, if it's possible because of structural issues, anything having to do with construction, the contractor needs to be addressing, not the OTPT. So we get evaluations where the OTPT puts on there, you know, to build or to install grab bars per code. We don't want to see that. That's not their area of expertise. They don't know anything about code. That's not what they need to be doing. Just recommend that the person needs a grab bar at 38 inches or whatever it is. The contractor then can determine whether or not structurally that grab bar can be installed. If the client doesn't have a contractor preference, then we will look at the lowest bid for review. But if they do have a preference, please let us know. I think Ken will go over this in more detail when he goes over the home mod packet, but we need to know which bid we're going to be looking at. So please let us know. The home modification, oh, there it is right there. There you go, Ken.
All right, so Naomi has been talking a lot about process, gathering the information, documentation. Once you've gathered all of that information, you've got the OT report, the bids, etc. This is a list of items that we need to see from you. So number 1, the client ID or member ID number. We use that to complete the research on that particular client. Have they used any funds in the past? What's their waiver, etc. And we should have the current contact information as well. But if you provide that ID number, we can get that information for you. The statement of understanding. That form was introduced a couple years ago. It really spells out some of the roles and responsibilities of the client during the process. So we do need to see that. Of course, we need to see the evaluations completed by the OTPT, and it should be all evaluations. Lately, we've been getting the addendums, and the addendum will reference prior evaluations. So if you send us the latest addendum and not those prior evaluations, we're going to send you a response asking for all of those evaluations. Please include any pictures or drawings as well, especially if they're complicated recommendations. The pictures really help clarify what it is they're recommending. Same for the bids. So if you solicited 2 bids and you received 2 bids back, we'd like to see both of those bids. But we do also need to know who is the client's preferred provider. So all of the bids that you receive, but then tell us who's their preferred provider, because that's the bid we're then going to take and start digging into further. Okay. Again, if there are contractor pictures or drawings, please forward those as well. Contractors are aware that they need to be providing diagrams, at a bare minimum, diagrams or pictures of things that they are proposing to do, such as ramps, bathroom remodels, bedroom remodels, etc. Sometimes on those contractor bids, it'll say right on the bid, please refer to our sketch or something along those lines, but the sketch never makes it to us. And so we'd ask that you forward those on. And then consent forms. Emma, if you can click the next few. On every home modification request, at least one consent form is going to be required, and that would be from the homeowner, the person that owns the dwelling. Okay, so if the client is the homeowner, then they would sign the consent form. If they're in a rental dwelling, the owner of the rental dwelling would sign that consent form. There are a couple of unique situations, such as if a client lives in a mobile home park. At that point, we would require a consent form from the mobile home park manager or owner for the exterior modifications only. So if a request comes in for a shower modification and an accessible ramp, well, we're going to have, in that case, two consent forms. We'd have a consent form from the owner of the mobile home itself, and then we're also going to have an additional consent form from the mobile home park manager or owner just for the ramp portion. Okay. You'll also see this sometimes in condominium complexes, or if there's a HOA involved. And an example that we give often is, let's say it's a multi-story condominium complex and the client lives in the middle floor, the second of 3 floors, and a roll-in shower is being specified. If there's a concrete subfloor, well, in order to change out that pan, they might have to chip into that concrete, and that is going to disturb all the neighboring properties. And at that point, the condominium association would need to provide a consent for that work. This is a holdup a lot of times if there's an HOA involved. So please be mindful of that. If somebody's living in a townhome complex, condo complex, take a look at what is being recommended and know that a lot of times those boards have restrictions on interior and exterior work. So you might get a follow-up from us about, do they need a consent for interior work as well? Just be mindful of that. The rights modifications Lydia has talked about, and then if you're going to be wanting to exceed the $14,000 cap, we would need the information that supports the items that are specified in regulation. So oftentimes we will get a narrative explaining why it should be justified to go over the cap. The narrative is fine. However, you'll receive a response from us asking for specifics that address the regulation requirements. Okay. And then please keep in mind that all the forms can be found on the HCBS website. And as Naomi mentioned, we are updating some of those forms. So new forms are being added. And when that happens, we notify all parties that new forms are available. This page right here, if you can go back. So if you are wanting to know what is necessary, if you want a screenshot or a checklist or whatever it is, this would be a great slide to take notice of. This is the #1 reason that you receive responses from us, is because something that is necessary was not submitted on the front end, and that's going to delay the entire process. So this is a good screenshot of what is actually necessary to move forward with the request. There's also out, I believe on the HCBS website, there is a checklist as well. It's much more in-depth and detailed, and you're welcome to use that as well if it helps in any way. But this would be a great kind of Cliff Note version of what's necessary. Okay, next please. All right, a quick quiz for you all. True or false? All initial home modification requests over 2499 must be sent to dola_homemod@state.co.us. What do you think? True or false? Yep. All right, the answer is true. Right? There you go. It is true. The initial request will be sent to that generic box, and that is where we go to grab those. And then from then on, you'll communicate with the individual. So if I end up picking up the project, if there's any additional communications, it'll be back and forth with you and I, or if Naomi grabs it, it'll be you and Naomi, etc. Okay. Another question for you all. True or false? If the member owns the home, a landlord consent form is not needed. What do y'all think about that one on the consent forms? If the member owns the home, do they have to provide a consent? Okay. Yep, a landlord consent form is needed. So there will always be a consent form. I think we have one more. All right, true or false? It is required to send OT evaluations to Division of Housing for review prior to soliciting bids. Okay. So the OT evaluation, its official name is Health First Colorado Home Modification Evaluation Form. So a little longer, we abbreviated to OT evaluation. So, and this is not a requirement, right? It's encouraged if you obtain an evaluation that seems out of the ordinary. Maybe it's unusual, you're just not sure, then you're more than welcome to send us that evaluation. In your message, just let us know that you are wanting us to review this and provide comment before you move forward with the process. We'll take a look at it. If it looks good to go, we'll let you know, or if maybe additional information is needed or additional clarifications. Okay. And then Naomi, you have your hand up.
Oh, yeah, sorry. So just so you're not confused, I think the consent form that we're using, I think the name of it is homeowner / landlord or property owner form, not just landlord.
Right. The official names are, you have a client / homeowner statement of understanding home modification program, and then you have a home modification property owner consent form.
Okay.
So those are the official names for them. And again, we tend to shorten things after saying it many, many times. But if you don't have those documents, you can let us know, and we can forward you blank copies so that you'll have them for future reference. Okay. All right, the approval process. This is for modifications that are $2,500 or more. All right. So once everything is done, it looks good, the project is approved, you will receive a notice, an email notification from the DOLA_HomeMod@state.co.us email address. The subject line is going to have the approved PAR. In parentheses there where you see the P0000, that will actually be the project number in Salesforce or the portal. So that will be an actual number there with the P, and then the client's initials. The email will contain a link of how you can access the approved PAR and see the multiple lines that are in there. One's approved, one will be pending. And then we ask that you not forward those approval notifications on, because if an enrolled Medicaid provider is being used, then you and that provider will receive the notification at the same time. And that way, all of you know that it's good to go and it came from Department of Housing. We stress that because it has happened in the past where there's been miscommunications, misunderstandings. Contractors have thought they were approved to complete the work. They did the work. They came to bill, and the project was never approved. And it creates quite a headache, as you might imagine, for all parties involved. So just be mindful of that. When the approval is noted, is sent, you'll get that email. Okay. And then again, why is it important? Because if they do work that wasn't approved, they may not be able to be paid for that work. And most people that do the work would like to receive the payment as well. Okay. All right, the portal. So we refer to this as the Division of Housing portal. The vendor is actually called Salesforce. This is the login page, the username and password. Once you enter that information, you will come to this page. Now, keep in mind that the way that Salesforce has set up the system is that only one case manager can be assigned per project. So if you log in and you are looking for somebody's name and cannot find it, if you are not the assigned case manager, you would not have access to that project. Okay, so this is very important, and we stress this for managers especially. If you know your case manager is leaving or departing and a replacement has been identified, please let us know. And that can be a very simple email. Basically, Joe Smith is departing, Jane Smith is replacing them and will take over all of their projects. If that's the case, you need to provide us the contact information for the case manager. So we'd like their name, email address, and phone number. And then we'll add that case manager to the portal and activate them. And then that case manager will get an email from Salesforce asking them to establish the username and password. All right. So now that you're in here and you are looking at your projects, you have several ways of finding your person. There's a list on the left-hand side that you can find their name. If you're unable to find it that way, there is a search box. It's highlighted there in yellow. You can type in their name. If you're still unable to locate the person, it could be that we entered this name spelled wrong, or maybe the case manager, it hasn't been switched over yet. So if you're looking for a project and you can't find it, let us know and we'll figure out what the problem is. Once you have found your project and you click on that person's name, you access the project, it will look like this. On the left side there, you'll see the project name. So that will say, John Doe project, etc. On the left side there, on the right side of your screen, it's talking about completion dates and uploading files. So the completion date is actually entered by the contractor. And once they enter that, it's notifying all parties that they are actually done with the project, start to finish. They're all done, okay? And then they would go into the upload files section, and they are going to provide us the necessary documentation in order to receive that additional billing unit. So this would include lien waivers, the written warranties, any permits that were pulled, pictures showing the work was completed, etc. Now, you also have access to this area as well. You can upload files directly into the project. If you do that, we would still ask that you send us an email notifying us that you have uploaded something to the project, as we do not always receive notification that a document was uploaded. So I'll give you an example. We're waiting to receive the consent form. You obtain that consent form, you can go in and upload it directly into that person's project. You would still need to send myself or Naomi or whoever you're interacting with email saying consent form uploaded for Joe Smith project, whatever it is. And then we'll know to go in there, review it, and move forward with the project. Okay. Next page, please. More information that you'll be able to see. And this we'd like to stress its ease and efficiency for all parties involved. And that is the PAR progress notes and the construction progress notes. They're highlighted there in yellow and circled in red. You are welcome to send us a status request. What's happening with this project? What we do is we access the project and we look at our notes. What's happening? Instead of that delay process of you asking us, then we look and send you a message, you can come in here directly and read those notes as well. And you'll see that, oh, we're waiting for a consent form. We're waiting for a bid. Whatever the reason is, it's oftentimes listed right there in those notes. So it'll help with efficiency for everybody because you're cutting out steps in the process. You can go directly to the source itself and find that information. Of course, if it's not there, you'll still need to send us that request. In the middle of the page there, you see expected completion dates. Once the project is approved, that date will actually default to 90 days out. And that is based on the rule, and we'll talk about that in 1 second. If there's an extension date, so in other words, the contractor cannot complete the work within that 90-day time frame, they are going to send us an email requesting an extension date, and that is going to include the reason for the extension and the end date they are looking for. We are still seeing delays due to labor shortages, material shortages, etc. So there is the possibility that an extension request is granted for these projects. The completion date, again, in the middle of the page there, that is actually inputted by the contractor, and they check that box that says project complete, and that's letting everybody know that they're done. The bottom left where it says date par approved by DOH, if there is a date entered there, that's because we at Division of Housing have entered that date. So that's another way that you can verify if the project was actually approved. Okay. Let's see. Oh, question answered. Okay. Completion date, photos not uploaded. All right. Oh, okay. So Rebecca, you're good on your question then?
Yeah, I think so. You just mentioned there was a box that needed to be checked. So yeah.
Okay. All right. Perfect.
Thanks, Ken.
Sure.
All right.
Next page, please. All right. Denials. So sometimes a request comes in and we're unable to grant the request either in whole or in part. If that is the situation, you will be notified of the part. If it's a portion of a request, you'll be notified which portion we will not be able to approve, and then a citation of the rule will be provided as well. This carries forward into, because if there was a denial on something, you're responsible for providing the client the 803 notice of action. It's an appeal notice. And so that way they would have the reason for the denial and the rule citation as well. There's a couple of bullet slides there. Yeah. Okay. All right. Contractors. So again, you and the contractor will receive the notice of approval at the same time. The contractor will then have 60 days to begin the work. Once they actually start the work, they have 30 days to complete it. So some contractors will start on day 1. Some will, for whatever reason, they wait till day 50. We have no control over that. But that is by rule, they have the 60 days to start it. But once they start, it's 30 days to finish. And again, extension requests can be asked for. And they can be granted if there is sufficient reasoning provided. Okay. On the bid, there is a new bid form. Contractors are aware of this. As you start seeing that bid form, what we tried to do is align the OT evaluation form and the bid form to make them more, well, aligned, if you will. On that bid form, though, at the bottom, there are areas for additional signatures. And we're going to start requesting, and it's going to start becoming a requirement that the actual client or homeowner, whomever is responsible for that property, is going to be signing off on those approved bids as well. Okay, so just be aware of that. All right, change orders. This was mentioned real early on, but remember, all change orders, whether it's a penny or thousands of dollars, must come to Division of Housing for review and approval. Okay, the 1-year warranty as well. All right. Was there a question, or did I see a hand go up? I'm not sure. Okay.
I don't see anything.
Okay, so complaints. Unfortunately, complaints do happen. If they do happen, one of the first things that we would like is for you to notify the provider that there's an issue so that they can address it. They're given the opportunity to address it, especially if we're in that 1-year time period. The contractor, by rule, will need to address their errors, if you will. Okay. Then you need to notify us. Okay. Now, we want to be made aware of any problems at any time during the process. The sooner everybody is made aware of the issue, the sooner corrective action can be taken. We have in the past had complaints that will come in 2 years after the fact. And it's really hard to address those issues 2 years after the fact. Obviously, we're going to follow up with the contractor about what was the issue, etc. But we really want to know, it's about timeliness on complaints. That's really the big issue, is timeliness. All right. Any issue that rises to the level of a complaint can be inspected. We do have one inspector, name is Mickey. She inspects the entire state. Myself and Naomi also conduct inspections. We tend to do the inspections around the Front Range, Denver metro area, and Fort Collins, Pueblo, those kind of areas. And Mickey tends to travel the rest of the state. So keep in mind that if our inspectors are in Durango and the complaint comes in Sterling, it might be a little bit before somebody can get out there to conduct an inspection. Okay. Behavioral issues, we really want to know about those up front. You know, if the contractor shows up hungover, they're using profane language, whatever the issue is, it's timeliness. Okay. And then keep in mind that the client can request another contractor fix the mistakes. This can create an issue in and of itself. It's really challenging sometimes to find an additional provider that is willing to come in behind somebody else to fix mistakes. It could be that they just don't want to get involved. There could be their own liability insurance reasons that they don't want to get involved, whatever the reason. So we really want to see if that initial contractor can address the issues, make it right. But if it's just not possible and we need to get somebody else out there, we'll try to do that. And in the end, funds can be recouped from the original contractor, but those wouldn't be way down the line on these complaints. Okay. All right. So before we move on, any issues on complaints, any questions, concerns? Okay. Hopefully you don't see many of those, if any, and everybody is pleased. All right, ARPA. So the American Rescue Plan Act, everybody's favorite topic. Currently, ARPA is available, and it provides up to $10,000 in additional funding for clients on eligible waivers. Okay? In order for ARPA to be utilized, all of the underlying waiver benefit funds must be exhausted. Okay, so if somebody has $14,000 under their waiver benefit and they have the $10,000 ARPA benefit, all of the $14,000 must be spent first. Okay, and that could happen in the same request. If the request is $20,000 and it's approved, that 14 is going to get eaten up, and then we're going to go 6,000 into the ARPA funds. Okay, all ARPA. I should say all home modification requests that involve ARPA funds must come to the Division of Housing for review and approval. That's whether it's a penny or the full 10,000. If ARPA is involved, it's got to come to us for review. We also need to know that the client is wanting to use their ARPA benefit. We will often get emails saying, I would like to use ARPA funds for this client, or we want to use it. It's not our decision. It's not the case manager's decision. It's the client's decision. And this can be accomplished very simply. One sentence in your email. Joe Smith would like to use his ARPA benefit. That's it. And now we know. Okay. If we don't see that, you're going to get a response from us saying, how would this person like to address the amount above their remaining limits? Okay. So again, even if ARPA is involved, all of the home modification rules and processes are applied. It's not free money. It's still got to follow the process, all the rules and regulations. Okay. We talked about the waiver benefit. Over the cap is a different is different than ARPA funds. So remember, our over the cap request is actually written in rule, and there are two specific things that must be met for over the cap to be granted. There would be a significant change in the client's needs since the last request, or they're in immediate, they can be sent to an institution immediately. And remember, immediately means now. So if they've been living in the house for 5 years and everything is good, but now they want this, that's not immediate, okay? So just keep that in mind on those over the cap requests. If over the cap request is granted, then ARPA funds would not be used because we're going over the cap, all right? Questions on ARPA. We still see a lot of confusion with ARPA and how that works. Anything come to mind? Any questions? Need clarifications? Okay. All right, so that's really what we want to talk to you about, the home modifications. There is, however, another benefit available, and this is a benefit for all Colorado state income tax payers, and that is a tax credit for home modifications. It's HB 18-1267, and it can provide up to $5,000 for qualified individuals to receive an income tax credit. So the key distinction here is that the person will be paying out of pocket first. So in other words, if somebody wants a ramp and they then they go to the doctor says, yes, they need a ramp, then they get their own contractor, they do the work, and then they come to the state for a credit. And really what they are is the citizen here is doing the home modification process on their own. So they are gathering the information from their doctor as to why they need the ramp. They are getting a bid from the contractor. They are providing the pictures, etc. And then there is a pre-qualification survey that they need to meet 6 requirements before they could move forward. There's income restrictions, residency restrictions, etc. But it is a benefit that a lot of people take advantage of. We tend to see a big uptick in this around tax time. People may not be aware of it or they forgot. And then when they're filling out their state income tax forms, there's a question towards the end that will ask about home modifications, and that will jog people's memories. This is also available for people that have exhausted their Medicaid benefits. So if somebody has used their waiver benefit, they've exhausted ARPA, they still have access to this, but remember, the key distinction is they'll be paying out of pocket for items and then coming back for a tax credit. If they do not have an income tax liability, then the credit would not be applied against anything. You have to have an income tax liability for this credit to apply. This legislature did expand this. It used to be one person, one qualifying individual in a household, and they have expanded that to all qualifying individuals. So if it's a husband and wife, for example, and each one needs something, it could be up to $5,000 for each person, the husband and the wife. Okay. The tax credit information can be found on the DOLA website. So that's the Department of Local Affairs website. At the top, you'll see some choices. Click on housing. That goes down the left side. You'll see community access team. You click on that, then it'll pop open the tax credit. You click on that, and then there's a host of information as to the regulation itself, how you can apply, the pre-qualification survey, etc. So that's where you would locate the tax credit. Questions on that? Have you all seen it, used it? If not, spread the word because it is scheduled to disappear in 2023. However, if we can get people to take advantage of it and show the legislature that it is a benefit, hopefully we can get that expanded timeline and dollar-wise. Okay.
Ken, we have a couple questions in the chat that I think are more related to ARPA fund, but then Rebecca also has her hand up and maybe might be about the slide.
Okay. So
You want to go ARPA or you want to go to Becca first?
let's do the tax credit since we're here.
Okay.
Okay, I don't know if you know this, Cam, but I had it asked of me on that tax credit. Do you know if the amount of the home modification, which can be deducted, if it's taken from their taxable income or straight off their taxes?
Oh, sorry. Naomi, you want to?
No, I was just gonna say, we're not tax experts, so I don't know that we have the ability to answer that question. Sorry, Rebecca, you would have to contact Division of Revenue
Okay.
and ask them that, or if that person has like a tax person that they can ask, but specific tax questions like that, unfortunately, we wouldn't be able to answer.
Okay. I will tell them to do that. Thank you.
Thanks.
Okay.
All right, and let's go back up to some of these other questions. So for ARPA, do you have to use all the ARPA funding at once? I believe is what Patricia's asking.
Nope. So let's say the client has exhausted their waiver benefit. The $14,000 has been used. And so now you have this $10,000 pool. There could be multiple requests within that $10,000, right? Maybe they need a grab bar and it's $100. And then they realize, well, we actually do need a shower modification because maybe the waiver benefit was used for a VPL, but now they need a shower modification. So they would have that $10,000 available. So it's essentially, it's a pool of money that can be used one time, multiple times, etc. Just keep in mind that regardless of dollar amount, any request with ARPA needs to come to the state for review and approval. Okay.
So then Linda Byers also asked, is there a disadvantage for clients that we should be telling them about related to using ARPA funds?
Well, that might be an opinion item, whether there's disadvantages. It's entirely up to the client. Just keep in mind, if a $20,000 request comes in and they have $14,000, they have to come up with a way to pay the extra $6,000. So however they want to do that, they could pay out of pocket and keep ARPA for later. They could remove items from the bid and only get certain items. So we're really looking at it more as an advantage in that there is extra funds available so that a client can receive the needs that are being recommended for them. So I'm not sure if there's a disadvantage in there. We'd like to look at it as an advantage. Now there's a time limit on this. March of 24, it will stop. So they have 18 months, just under 2 years left to use the ARPA funds if needed.
Great. And then the last question, oh, maybe not. The next question I see is from Crystal. Is there somewhere we can direct to if they have questions about this tax benefit and how to follow through with the process? And Naomi did put that in the chat for you, Crystal.
Yeah. So there's a designated email address for that. It's dola_homemod_tax_credit@state.co.us. And that is an email box that we monitor as well, because all of the home mod tax credit, it goes to that email address, and we look through there for any other. Thank you, Lydia, for putting that in the chat. So that is where an individual would send their inquiries. One thing I want to let you all know is that we have been having some technical issues on that with the pre-qualification survey. So if you have any client or member that has tried to do that pre-qualification survey and they run into an error, we are aware of that. They would just send an email to that home mod tax credit address and let us know that they ran into an error, and then we will work with that person directly so that they can move forward on that process. Okay. Let's see, what else do we have here?
I think we're good on questions, so we can go back to the slide.
There's one about caretaker here.
Oh, sorry, that one's new. If the client lives with a caretaker, can they use the home mod for a caretaker's home, and does that affect anything?
No, home mods are for the client. They're for the member. It's specifically restricted in regulation that home mods are not for the convenience of anybody other than the client. Patricia, does that address what you're getting at?
So, I mean, in this situation, if they're living with the caretaker and their caretaker is like their landlord kind of situation, then the individual could get the home modification for themselves, because they're living in like a rental type situation or they're living with someone else, but it wouldn't be for the convenience of that caretaker.
Right. So it almost sounds like that's a PASA or
Yeah,
host home.
it just depends. Because it just kind of depends on what that housing situation is. Because you can live with a caretaker. Your caretaker could be your husband or your brother-in-law or whatever, and live in their house. But the modification would be specific to the individual, not the caretaker.
So let's give a real life example. We get a request and it says the client needs a roll-in shower so the caretaker has more room to wash their hair. So in that case, the request is really for the caretaker's convenience, right? It's the roll-in shower is being recommended so the caretaker has more room to wash the client. That would be restricted. The recommendation has to come in and say a roll-in shower is being recommended for the client because the client needs X and Y. It's not for the caregivers. Okay. So you probably see a lot of those responses from us as well saying, okay, we can address this, this, and this, but this portion, because it was specifically addressed towards the caretaker, we can't do that particular item. So again, back to the tax credit real quick. It is available to homeowners and renters. Just keep in mind that there is a pre-qualification survey that they would have to complete before they could move forward. And a lot of that has to do with residency, income, etc. Okay. Next slide, please. I believe the next one is just general questions. Yep. And then our contact information is here. So we'll open it up to everybody for anything. Any questions, comments, concerns, issues, etc.
So right before we do, I just wanted to just quickly, I'll let everybody know, those of you that have been working with Michelle Madrell, she unfortunately went to a different position. So we're glad that we're sad that she left. She is still like transitioning and still working on, current home mod projects that she has, but please continue to send all home mod packets to that dolahomemod.state.co.us. Me, Naomi, I'm actually reviewing the ones that Michelle would have been looking at, but still continue to send to that generic email box to be sure that we are getting all of those home mod requests. So thanks.
Patricia?
But I was wondering if you guys had talked about subcontractors, and maybe I missed it and I'll just have to go back and review the webinar.
Anything in particular?
Well, I was wondering, like, for an example would be like, I understand it's hard to get the contractors, but what if we were willing to do the work ourselves? Do we just have to have a contractor who hires it out to the sub, or are subs allowed that don't have to go through the whole Medicaid qualifications? Or
so you're when you say you're willing to do the work yourself, you mean the SEP?
Like a home modification, like if we had to like the roll-in shower part,
No, I know, but you're saying that you're willing to do it yourself, but by yourself you mean the SEP is going to do the work?
Well, like my husband would do the work, or my son.
Okay. So the problem when or the issue to look at is whoever is going to be doing that construction work has to be able to bill Medicaid.
Okay.
So they have to be an enrolled provider if they want to get paid.
Okay. That's what I needed to know.
Mm-hmm.
Thank you.
Mm-hmm.
Well, just like other services through the waiver, Patricia, you could talk to people that are already providers to see if your husband or your son could be hired by them or could be subcontracted with them, but that would be separate from our processes.
And then, and if you become a provider, you have to be able to be available to just more than just your client, the client, right?
No, you can, if you're a home mod provider or contractor, you can do home mods from wherever you want.
Okay.
You're not restricted to doing them for your particular area or person. It's up to the home mod provider who they want to provide services for.
Okay. All right. Perfect. Thank you.
Mhm.
So, Patricia, specifically, what you're getting at is addressed in regulation, and I'll just put it out there that it's 8.493.3.G as in George, and that addresses the work performed by others. But in the end, you would need an enrolled provider to oversee that. So you might want to look at that citation in the regulation, because that goes to the heart of what you're asking. Okay. Other questions?
Did we call out the issues we had before about approved projects and if someone moves to like a skilled nursing facility or passed away? I know we talked about that, but I wasn't sure if I missed that part earlier.
No, I did mention that. I did ask case managers to please let the providers know if someone does change their status, eligibility status, because that can definitely cause problems.
Well, and feel free to put questions in the chat box. If you don't want to come off mute, you're welcome to raise your hand. But this is definitely your time to ask us any questions you might have. So there is no wrong question if you're shy.
A facility, would that disqualify what was already approved, just for in case? I'm kind of curious.
What was the question again? I'm sorry.
Patricia, if you'd like to repeat that, please.
Was in the middle of a home mod, and then they got put in a nursing facility, let's say, for some reason. Would that stop the home mod, or how would that work?
That's a good question, because that's exactly what actually happened. So if you're in the middle of a home mod and the person either passes away or they get moved to a facility, you need to let us know ASAP. Let the contractor know, because depending on where in the process the home mod is, will determine how far they can go and what they can get paid for. So as soon as somebody passes or they get moved out into a facility and it's during the home mod, please let us know. And we will contact the contractor as far as coordinating what can still be completed or not completed, and then what can get paid or not get paid. That's a good question. Thank you.
Looks like Bonnie also has her hand up. Sorry.
Hi, this is Bonnie Kuhn with Conejosa and Costilla Single Entry Point. And my question is, or my comment is, we have been working with Ray 4, with Tina Gonzalez with our home modification issues. And I also just responded to an email from state personnel yesterday. But, you know, we have reached out even outside of our catchment area for PTs and OTs. And as of yet, we've not been able to secure one to complete any of our home mod evals. And also at this point, we have one Medicaid certified contractor to cover the whole San Luis Valley, which includes 6 counties. And so I'm just wondering if there's anything further or anyone else that I could reach out to in regards to this situation. I know we have had some interest. I received a phone call from a local home health agency last week, and they are possibly looking at resuming doing some of those OT evals. Is there somebody I can direct them to at HCBS to answer any questions they have if they want to proceed with this process?
Yes, off the top of my head, I can't remember who outside of our group could do that. So I think the first place to start would be just to email Emily Walsh and copy myself, and then we'll work within HCBS to figure out who you need to talk to or who we can hook that home health agency up with.
Okay, thank you.
And Bonnie, I'm just out of curiosity, who's the home mod provider, the home mod contractor that you've got right now?
Give me a second to think of his name. I'm just thinking of his personal name and not his
Is it
business
Charles?
name.
Charles Russo, or is it Mark Martinez?
No, it is Hector Ocampo,
Hector,
HMO,
Hector. Okay,
HMO
HMO,
contractors.
Okay.
Yeah.
I'll look on the map and see where exactly that area is, because I don't.
Yeah, and he's we actually have 2 contractors that are certified, but we have the other one who just has not bid on anything like in over probably 2 years.
Oh, is that MV Plumbing?
Yep.
Yeah. Okay.
So
Yeah, I think they're out of the program, but okay. I was just curious who the contractor was. All right, thank you.
sure.
All right. Any other questions from anyone?
Sorry, we could get one more in the chat, and I know we have Natalie with her hand raised. Let's go back to the chat question because it was about the skilled nursing facility issue we were talking about. It says, is it only an issue if the facility is using Medicaid funds, for example, if they're in rehab and using Medicare funds? So, Naomi can speak to this better than I can, but I think anytime that the member is no longer in the home and in any type of temporary placement, we certainly would want to be notified so that we can talk to the contractor and figure out what we can do if the project needs to be put on hold and if they continue to be eligible. The real issue is them being eligible for the waiver. So as long as they're still on their same waiver and they haven't switched over to skilled nursing facility, that is different than what Naomi and I are talking about. Naomi, did you want to add anything to that?
No, that's it. We're just really concerned with the individual's eligibility for that for the waiver. Yes, correct.
Okay. And then Natalie, you can go ahead and come off mute and ask us your question.
Hi, this is actually Debbie. And I had a contractor say that you had to have state inspection before they're paid the second unit. I don't think that's true. I wanted to let them know because he's not bidding because of that.
Okay. So no, the in order for the contractor to request approval of that second or release that second unit, they do not have to get the project inspected by Mickey. Now, if they had a permit, the local jurisdiction would need to inspect for that permit, but they don't need a Medicaid inspection to get that second unit done, approved. They have to provide other information,
Sure.
but it's not just they don't have to do that inspection. No.
Okay, thank you.
Just a few more minutes before our time is up. So our contact information is on this page. We'll upload the recording as well as the slides from this training to the HCBS website for review. But if you guys have questions or you think of something, feel free to reach out to one of us to get an answer. And with that, we'll let you guys go. Thanks so much for joining us.
Thank you.
Thank you.
Thanks, everyone.
Thank you.